Hi, I'm Dr. Tonya. I'm a radiation oncologist and health coach, and I help cancer survivors in all stages of their cancer journey navigate through their treatment and then use this cancer journey as a springboard to transform their lives into the life that they know they should be living. So today I'm answering the question, why do I even need radiation? You had surgery, your surgeon said they got it all, or you had chemotherapy and they did imaging and all of the cancer is gone, but yet and still they're recommending you to a radiation doctor to talk to you about radiation. So you're wondering, if they got it all, if all the cancer's gone, why do I need radiation treatments? Well, the surgery removed all of the cancer that they could see. And the chemotherapy melted away all of the cancer that could be seen by the imaging or the x-rays. But history shows us that even if you take all of the cancer out with surgery, or the cancer, you get what we call a complete response to the chemotherapy, there is still a percentage of people where the cancer comes back. So we want to know, why is that? Well, one of the reasons we realized is that even though all of the cancer that we could see has been removed, there's still cancer that's too small for the eye to see, that's microscopic in size, that is still there. And it only takes that tiny little seed of cancer to actually grow into another cancer. So we found that cancers typically come back in the area where the original cancer was, or there may have been microscopic cancer cells that have traveled through what we call the lymphatic channels and settled in lymph nodes that drain that area where the cancer originally was. So any radiation treatments that are recommended would be treating that local area or the area where that original cancer drains to in the lymph nodes. And that treats any microscopic cells that may still be in those tissues. And when we did studies to compare people who just got the surgery to people who got the surgery plus the radiation treatments, we found that the people who got the radiation lowered the chances that their cancer would come back. Same studies were done with patients who had gotten complete responses to chemotherapy. If you've been recommended to receive radiation, those studies showed that adding the radiation treatments decreased the likelihood that the cancer would come back. So when we find that you get a significant benefit to adding the radiation, we know that the radiation is doing something. It's adding value to your treatment and is decreasing the chance that your cancer can come back. And one thing that we know about cancer is the best time to cure cancer is to cure it the first time it's diagnosed. Because if cancer comes back, there's absolutely no guarantee that the cancer will come back in a way that is curable. So we want to do everything that we can do the first time cancer is diagnosed to make sure it doesn't come back. So if that means that we take it out with surgery and then we add radiation, that is what we'll recommend. If it means that you got chemotherapy and then we had to have radiation, that's what we'll recommend. And then for some of you, you may need all three. You may need surgery, you may need chemotherapy and radiation treatments in order to eradicate all of the visible and microscopic disease that we know is possible. And when we do that, that decreases the chance that your cancer will come back. Now, is it a guarantee that your cancer won't come back? No, there's still a tiny percentage of patients that cancer will still come back despite getting all of that treatment. But the recommendation for radiation is to further decrease the chances that your cancer will come back so that you don't ever have to go through this again. I'm Dr. Tonya. I am your sister in the journey. I am here to help you navigate your cancer care with confidence and decrease any anxiety that you may be having about your treatment. If you have other topics that you want me to cover, other questions that you have, please drop them in the comments. I would love to answer them for you. Please subscribe to this channel to keep getting information about radiation, and share this with someone who you know needs it. I'm Dr. Tonya. I will see you guys next time.